Jill,
Hi,
you could have.
everyone. Thanks for joining us today. I am Jill Vitale-Aussem with the Eden Alternative, and we are going to have a really interesting and great conversation today. Right now we are in an unprecedented time where senior living providers, people who are supporting elders living in their home, are doing everything that they can to protect the health of older people and others who are most at risk of COVID-19. And some really interesting things start to come up. How do we balance social distancing without compromising well-being? How do we follow infection control guidelines with and support well-being? And so what we are really excited about today is to have two experts with us. And so I am beyond excited to have Dr. Al Power and Dr. Bill Thomas with us today to talk about, it's really a complicated situation, but to talk about things, we invite all of you who are with us live to pop questions and comments into the comment box for this feed, and we will be addressing those as we can. So I would love for Bill and Al to introduce yourselves and tell everyone a little bit about you.
Hi, everybody. I'm Al Power. I'm a geriatrician by training. After many years of working in long-term care, I have been spending the last several years doing education and consulting, and have written a couple books about new ways of seeing dementia, including Dementia Beyond Drugs and Dementia Beyond Disease. I also work part-time in Ontario, Canada, at the Research Institute for Aging as the Schlegel Chair in Aging and Dementia Innovation. So when I'm allowed to go back across the border, I'll be up there about 1 week per month doing some work as well.
Nice.
Thanks.
I'm Dr. Bill Thomas, along with my wife, Judith Myers-Thomas. We are the co-founders of the Eden Alternative movement, and very proud of that. I also was a founder of the Greenhouse model of care, did some work in acute care with a senior ER model, and currently I'm spending a lot of time thinking about how the long-term care senior living space can deal effectively with this terrible global pandemic. And I was happy, Jill, that you asked me to join you. I'd just say one last thing, like Al, you're getting two geriatricians for the price of one. And that just doesn't happen every day. So,
that does not happen every day. And we are so glad to have both of you with us. So let's jump in. And again, this is a really complex situation. We talk a lot in the Eden Alternative about balancing risk, and right now, people, the decisions they make about risk for themselves also impacts other people as well, which is a very interesting kind of quandary. So I'm just going to start with a really broad question. How do you balance safety and infection control with well-being? What are your thoughts on that? What things are you hearing from people?
Why don't you go ahead, Bill?
Well, I would actually start with the observation that, and I'm talking for Al and I, who are clinical people, and our background is clinical. We've been balancing infection control and well-being our entire career. Ever since the day we started medical school, we've been doing it. If you want total infection control, you have to live in the bubble like the children with immune deficiency disorder. Yeah. So we've always been balancing infection control and well-being. And we've always been trading off between the two things. And I'll let Al, jump in here, but I'll just say what makes this a little more challenging is that there's a public dimension. We've been balancing these questions privately, mainly for individual patients. Now it's not just one person. It's really a much broader question. I'll kick it over to you, Al.
Okay, thanks, Bill. Yeah, I certainly second everything Bill says. I don't think you're going to hear a lot of disagreement between this time, but just to add a bit, because I've been asked a lot of questions. I've already done a couple of webinars on this in the last couple of weeks. A lot of my work and my questions have centered around how do we help maintain those precautions for people living with different forms of dementia. And so just once again, we'll drill down on this, but a couple of general comments. Number one, this is a very complex issue. And there's no cookie cutters, there's no formula you're going to plug everybody into. So for those of you who like to use words like person-centered care or individualized care, person-directed care, this is going to challenge you to really live those words much more probably than anything you've ever done before, because there is no one solution. The other thing I would say is when we talk about people with dementia, the way to find solutions to your challenges is to have the right mindset about how we're seeing dementia and the experience of people with dementia. If you start out in the wrong place, then better solutions, creative solutions don't come to you because you're inside a box where you're only looking at blinders. So we will probably try to tease that out a little bit during this time.
Yes, I think that that's so important. We had some questions that came in even before we started today and I don't know, Bill, are you typing? Are you multitasking while we're talking?
No, I'm playing with my pen.
I'm a fiddler too, so it's okay. But we had some questions come in, and one of those particularly was about individuals living with dementia. So we'd love to get into some of that. And a reminder for everybody who's here with us, we would welcome, and Dr. Power and Dr. Thomas had already said they welcome your questions, your scenarios. If you want to put those in the chat box for questions you might have. So you want to jump into some of the questions that we got from people that are out there in the field? Does that sound like a good thing to do? So one question was, and this came from, there's a Facebook group of nursing home administrators that I'm a part of. And I do want to point out, you know, as we all know, the folks that are working in these communities and working in home care to support elders, they are in a very, very challenging time, and really, really doing their best. And a lot of them are also, you know, really understanding that, yes, we need to practice infection control, but they also are really looking at now is the time when people are most at risk for loneliness, helplessness, and boredom. And so somebody asked the question, how do we maintain person-directed centeredness in this very overwhelming time? Any thoughts on that?
I'll let you start, Bill.
You let me start?
Yeah, the place thing, man. So go for it.
So actually, asking the question is the most important first step. So there are people out there who are just willing to discard any sense of the person-directedness under the rubric of safety. And pop it in the dustbin and keep on going. So if you're asking the question, you're halfway there. And because you're saying, wow, this is really tough. I want to follow infection control guidelines without compromising well-being in a person-centered way. Man, that's hard. That's good news that you're asking the question. That's the first thing I'd say. And the second thing is that I've always really, you know, made the point that people, I'm going to use a political term in the sense that people are citizens. People are citizens of a nation. They've been citizens of a nation. They have the obligations of citizenship. And if they're living with dementia, they're citizens of a nation. They have the obligations of citizenship. It is actually dehumanizing to say a person living with dementia no longer has an obligation to the common good or to the fellow citizens. That's kind of bad. So it's actually better, I think, to say people, I'm just giving an example, people living with dementia share the social obligations that we are sharing. But I'll throw it over to Al. He's done a lot more work on this than I have.
Yeah, no, absolutely. I agree with that 100%. And I think that, once again, we are, as Bill said, we are balancing two things. We're negotiating risk. There's no elimination of risk. And there's some, particularly when you look at long-term care with its regulations, there's a fundamental conflict in long-term care regulations that exists in spite of the best efforts of good people between safety and quality of life. If you maximize one, you are going to hamper the other. And a set of regulations that expects you to maximize both is always open to failure. You cannot win. So as I tell people, well, what if this happens? What if that happens? Well, that can happen because you're balancing two things that are irreconcilable, because that's the corner the regulations put us in. So we do the best we can. We do the right thing as best we can. We document what we do. And we, once again, as Bill said, really try to look at the person, try to look at the individual, try to understand what it is that that person values, what is the best way to keep that person as safe as possible, keeping the general welfare and of other citizens in mind too, but understanding that there are certain boundaries that we can't cross. Number one, because they are drastic infringements of rights, but also because they have no proven benefit and will actually hurt people more than help them.
Thank you. And I really appreciate you bringing up that citizenship notion. And that's a theme that we've been hearing a little bit of on our weekly calls. Our friend Jack Cumming, who's been coming there, is talking about, the difference between living at a community. And he talked about everybody who's a resident of this community. There's no distinction between how old you are and if you live there and if you're young and if you work there, that everybody is an adult or a human being going through this experience together. And the more, and Denise Boudreau-Scott also brought this up, the more we do with and talk with people, instead of, it's our job to just take care of you, which doesn't just happen with individuals living with dementia. It seems to happen a lot with just people being older and needing supportive services. When people are all working, and that citizenship, what do we want to do together to protect our community? I've seen as a family member of parents who live in a community, people own it more too. And it's not this, oh, now I feel like I'm in prison kind of situation, when everybody understands their role in part of the whole. Al, I know you've gotten some questions from people with some pretty specific things of how do we handle this? Do you want to share any of those things?
Yeah, the biggest concern I have, and once again, these are very real concerns, is what do you do with a person who may be exposed, may be positive, but you are worried that they will not remember how to practice all those good hygiene and infection control procedures. And you worry about this fairly contagious disease spreading throughout a fairly closed living area. And once again, this is an area where as Bill said, we don't have the boy in the bubble here. This is going to be imperfect, but we do the best we can. And having said what we said, certainly when there are emergencies, there is a certain amount of movement toward a more formalized structure and towards some more rules, because you need to have kind of a chain of command and those kinds of things when you're dealing with emergency situations. But as you said, engaging people is really important. And then understanding, well, what are the best things we can do for people that can't remember, and what are the best things we can't do? And I just want to remind people that there are a couple of things that I feel you absolutely cannot do. What you can do is really going to vary with that individual, and we can get into that. But let's start with what I think is not good to do, because I've seen these floated around in previous discussions. First of all, let's talk about physical restraints. Physical restraints were thrown out the window a good 2 decades ago. They were proven to be ineffective and dangerous, to increase the risk of injury, even death. To give this to a person who is living with dementia, who on top of that is sick, is dangerous. And if it was thrown out as bad practice 20 years ago, this is not a reason to bring it back. So absolutely. The second one is, well, let's give people a psychotropic medication like an antipsychotic. And I tend to not use the word chemical restraint, because I believe a restraint is something that keeps people from moving. And I don't believe there's ever an instance where you want to give somebody a drug to keep them from moving, because all you're going to do is make them more likely to fall or pass out or have other problems. And this is particularly one case. And once again, if we think critically about this, what are the things people are forgetting to do? They're forgetting to stay 6 feet away. maybe stay in a confined space, maybe wash their hands after touching things, maybe not touch their face, maybe not go into certain areas like another person's room. There is no pill that tells your brain to do those things. There's no pill you can take that will say, oh, I have to wash my hands, or, oh, I shouldn't go in that doorway. The only thing these pills do is sedate people. When you've got someone who's already sick, who may have fevers, who may have difficulty with adequate oral intake, who may have unsteadiness on their feet, the last thing you want to do is give people something that is going to make their life more dangerous. So those are the things I think that we absolutely should do.
Yeah.
And then we'll talk about where we can start to engage people positively.
Right. And so we have a comment here from David Green, and I think it's showing up on the screen, that nobody wants to make the wrong decision. I think this is what it comes down to, right? And in hindsight, have to answer for possibly having contributed to an outbreak in a home. Who can we reach out to for guidance? If a guiding organization, CDC, CMS, ACA can give us some ideas about what we can safely do to relieve some of the isolation that elders are experiencing, I think we'd be able to try some things more comfortably. Yeah, I don't know if you have any thoughts on that. I mean, having been a nursing home administrator, I know the general fear that comes from not wanting to mess things up and not wanting to follow regulations. And now it's even more heightened, right? And there's so much more on the line. I don't know if you have any thoughts on that, on David's comment.
Well, I do. I'd actually offer a couple of things. So first, I think the guidelines on the CDC site are very good. They're pretty straightforward. They're simple. They're pretty easy to follow. They're authoritative. It's a great place to say we're doing everything we can to follow the CDC guidelines. You're in a good place if you're doing that. Then I want to add something I'm hearing from clinicians in New York City who are in acute care settings, who are really right now, as you can imagine, completely overwhelmed with the exposure to the virus. And what people are saying is that it's becoming more and more clear that decontaminating surfaces, washing hands, and keeping your hands off your face, those are the big three. Masks they have value. The N95, hospital masks, they have a role to play in acute care where there's huge virus loads and so on. But the thing I'm pointing out is that the key things that really make a difference are completely under our control. I mean, we can decontaminate surfaces, we can wash hands, we can keep hands off the face. So a few years back, I did work with a company that wanted to explore what would happen in a nursing home if you just really decontaminated surfaces. And so we worked together to create a game. It was like a tournament style competition for decontaminating surfaces. And we watched all types of infections drop off significantly. So what I take away from that is this is a great time to gamify or to turn into a game, cleaning surfaces, washing hands, keeping your hands off your face. Let the games begin. And so that's something that's in your power, and you can do it. And I'll throw it over to Al because I'm sure you're seeing interesting things.
Absolutely. I'll second that with a couple other comments. Still, this is by and large an infection that's spread by droplet, which means people cough it or sneeze it or pass it through their hands onto a surface. Other people touch it, then touch their faces, inhale it, whatever, get it into their respiratory system. And so, hang on. Yeah. So anyway, I have a little 21-month old.
I love it.
I do too.
So anyway, people inhale it and get into their lungs. That's still the way it happens. Now, when you're working in close, when you're providing personal care, where you're going to get secretions on you, or you're in people's face, acute care, or even close personal care, absolutely, masks, gowns, and this is not the mask that you wear to 5 stores and contaminate, or the gloves that you take from the grocery store to the hardware store, which is totally inappropriate. These are things you take off before you leave the room and then wash up every time you leave. But for the most part, for us, it's not touching things, not touching our face, washing our hands, washing our hands, washing our hands. Absolutely. And then your comment about letting the games begin. I was on a wonderful webinar with Ann Basting from Time Slips a couple weeks ago. And, you know, Ann Basting has a lot of history of improv theater. And the rule of improv, the main rule is yes and. When somebody starts a story, you don't say that won't work. You say yes and. So she said, we have a lot of regulations that are very scary right now. Let's start saying yes and. Okay, we must wash our hands. Yes, and this is how we're going to do it with this individual. And so that's maybe a way we can start. Just to make a quick comment, because I said what you can't do, we'll just start the ball rolling with some of the things you can do. First of all, if you want people to stay in the room has to be a place where they feel a sense of comfort and belonging. And so in order to do that, let's look at those well-being domains that we talk about with Eden: identity, connection, security, autonomy, meaning, growth, joy. Do we bring that feeling of well-being into the person's space so that they don't feel that they need to look for those things in other places? Nobody can sit still forever. Look at me, I'm outdoors because we finally have sunshine. I can't stand to be cooped up in the house anymore. So we realize it's imperfect. But the more we can do to find meaning and to find a true sense of comfort and belonging in one's personal space, the better chance we have of meeting needs and not having people looking for things elsewhere. So there's some places to start. We can certainly help people wash their hands. We can make a game of it. We can, do some following people around if necessary, or even have what I call zone defense. Maybe it's two people and there's one staff member on one hallway who can kind of double team them and keep an eye on them and help direct them, help them washing hands, and many more things we can do. And there's so many different types of engagement out there. I won't begin to go with all the websites that have expanded from Pioneer to Dimensional Alliance. They have all these different ways you can engage people virtually too, or in the moment, to help them to find a bit more comfort where they are.
Great, thank you. And we have a lot of other questions coming up here. And if I am not pronouncing this correctly, please forgive me. But we've got Orchidia, I think is how you say it, from New Zealand.
Orchidia, yeah.
Thank you for Hi, thanks for joining from New Zealand. Thank you for organizing this conversation. I do agree regarding the negotiation. What I found challenging is that people, once again, are going back to focusing on just clinical needs due to pandemic fears. As you are aware, in New Zealand, we are in lockdown, and the level of trauma this is creating for seniors and families is massive.
I think there's a problem with separating clinical and the sort of holistic well-being things, because a lot of the problems, as I was alluding to, with people not staying in their room, getting more distressed, comes because we're focusing only on the clinical and we're ignoring all those life-giving things that we think aren't important anymore, I would say. What do you think, Bill?
Yeah, at the end of the day, it's about a life worth living. And, clinical considerations are necessary, but not sufficient. So I tip my hat to the clinical focus, the clinical domain. It's super important, currently saving hundreds of thousands of lives. And to go back to Al's comment, and there's more to life than clinical treatment. So we're being called, if medicine and nursing and the other allied health professions were really just following algorithms alone, we could have robots do the work. But it's the reason humans do the work is that it's complicated, and there are competing demands, and people are different, and you have to make adjustments as you go along in order to really fully deliver both health and well-being to your best ability.
Here's the good news, though. If you can find ways to engage people, to help meet their needs, to help calm distress in this situation, when this situation passes, your support of that person will be so much easier than it ever was, because you learn so much about that person, that unique individual needs. If you can do it during a time of crisis, then on an average day, it'll be a breeze.
That's a great point. And I want to go back to what Bill said in the beginning, is just even asking that question and having it on the radar of how are we supporting a life worth living and well-being during this is part of it, right? And there aren't easy answers. This is complicated, and person-directed care is complicated too. So like you said, this, if you can do it now, you can do it even better in normal times. We've got another question from Becca, and Becca is an amazing OT PhD candidate who's working with the Eden Alternative, and she brought up this question. Hello, thank you for doing this. What are some ways that individuals like myself who are not working on the front lines help safely? I miss visiting the elders in my community or volunteering at community care centers, and would love to hear your own input on ways to connect with elders to decrease the loneliness they may feel effectively during this time. How do we do this? How do we decrease loneliness if you're not right there working in a community? Thoughts?
Well, you know, seeing us here on sort of a sharing platform just makes me think that for those who can engage virtually, this is where the explosion in approaches has come out. And as I mentioned, there are a couple of websites, Pioneer Network and the Dementia Action Alliance, daanow.org, Karen Stobie's organization In the Moment, Time Slips, that are talking about ways to virtually engage people. Time Slips has opened up all of their creative engagements for free for the time being, so that people will try them and use them. Most of the others are also free engagements. So there are many things we can do virtually. I also wonder, and a lot of it depends on the organization, because a lot of them have rules about visitation right now. But it seems to me that there ought to be ways to get more people in the building safely. If somebody could do some background clerical work so that someone who needs to be with the person could have more time with the person. And once again, you know, I don't want to go against anybody's regulations, but I think we have to be creative right now, because we don't have enough people in the building with all these restrictions to meet those needs. So how can we re-engage maybe professionals in a volunteer capacity or some paid employee doing a different job than what they were paid to do before? I just think we have to start thinking differently about this.
I saw an article, I can't remember where it was, but a family member who got a job at a community so she could be with her mom. And the community needed team members. And so, yeah, that's, again, no easy answers, but how can we do that and meet the regulations and the appropriate infection control practices? So let's see, Mel. Hi, Mel. Mel says treatment needs to fit inside of genuine human caring. Absolutely. And Laura, thank you. And addressing the needs of the spirit actually enhances immunity. And that's a really good point that Laura brought up with right there, the research around the different things that lead to a healthier physical being, right? And there's all the research on being engaged, having purpose, having your spiritual needs addressed. So are we overlooking some of those things? Do you know what I mean? Like, are we undermining people's physical health with some of this?
Yeah, I will just say that the biggest insight that I think Jude and I had in the earliest years of Eden was that it wasn't enough to simply take care of people's blood sugar and blood pressure and, you know, hemiparesis, that we actually had to do more than that. And when we fail to think of the person as a fully human being, we're doing a disservice, and this is clear, we're doing a disservice to them. The thing is, we're also doing a disservice to ourselves. And I remember, I'm just gonna, talking about social distancing, I remember taking care of a woman who was living in a kind of a comatose state. Didn't give the appearance of being responsive. And one day I came in, was visiting with her, and I found that there was an aide who was assisting her, but wasn't talking to her and wasn't relating to her and wasn't telling her what was going on and so on, just treating her like an object. And I did my best to coach that aide, but then I realized that that kind of behavior is dangerous for that aide, to treat another human as if they're not human. That's not something you want to be You don't want to see that in a community, and that we really need to cultivate this ability to see people as fully human, even when they're not responding to us in a way that we find to be conventionally appropriate. So that's a kind of a long way around the horn to say this, that this, as picking up on what Al said, this has the opportunity to make us better. We're raising the bar. It's more difficult. It's more challenging. We're going to have to be more creative and more compassionate and better at communicating in order to get through this. And then when we do get through this, we're going to be better at everything.
Yeah.
So I look forward to that day.
Yeah.
Jill, can I share a little story that I think really speaks to what Bill's saying about sometimes the dehumanizing effects of the way our system sometimes asks us to support people, the dehumanizing effects of the ways we're sometimes taught to see dementia, for example. I attended a webinar a few weeks ago, and I had the most wonderful moment of irony that I have to share with everybody. And this is not to point fingers at the presenter, because I think the vast majority of experts who presented this topic would have done exactly the same thing. It shows the mindset that I talked about. But they were talking about COVID and its effects on people living with dementia and those who care for them. And one of the slides mentioned that people with dementia in the course of this emergency will have several BPSDs, behavioral and psychological symptoms of dementia. And the slide listed among them anxiety, agitation, irritability. And their recommendation was behavior management. That said, the caregivers would have several psychological effects, including anxiety, agitation, irritability, and their recommendation was social support.
Yeah.
So here are two different groups of people responding to this very real crisis in exactly the same way, but the label of dementia pathologized reaction.
Yeah.
The other people said, well, of course, they need support. So once again, this shows how overly focusing on just the medical and actually putting that label in front of the person gets to be quite dangerous as far as what we do. They even said, try non-pharmacologic approaches first, So I know with a caregiver or a care partner, don't jump to antipsychotics. So that mindset, we saw people on spring break who wouldn't stay off the beach and isolate. Would we ever restrain them or give them antipsychotics? Of course not. So why all of a sudden does that become something we put on the table? Because somebody else might be contagious. Where does that system make us make decisions for people we would not make for ourselves?
Wow.
I got to tell you, Al, that is a great story, and I'm afraid I know exactly what you mean.
You can download the slides. You can see the words on the slides, right?
Yeah. So and Jill, if you don't have a question popping up, there's something I'd like to say.
Well, we do, but if you're willing to keep going, we'll keep going. So go ahead.
Well, I want to make a point about this, and it gets to the complexities, and it gets to kind of Al's illustration of the kind of the two track. There's a concept in law called the right to folly. And really, once in our society, people reach a legal majority, age of majority, what it really means is you get to do dumb stuff and basically no one can stop you. And that's what's fun about being grown up. It's not doing good stuff. It's doing dumb stuff. That's the real fun. But anyway, the right to folly, like all rights, has limitations on it. So the right to folly, after one of our earlier calls with the Eden Alternative, somebody got a hold of me and asked me about a parent this person felt the parent wasn't following these guidelines well enough. And the question was, well, this person's an older person. Can they just do what they want? And the answer was that person has a right to folly, and the right to folly is limited when that behavior puts other people at risk or at danger. And that's, to get to Al's point, that's true for everyone.
Yeah.
And so it's actually if we follow what we know to be true and we wrestle with the specifics, and to what Al's saying, and we don't pathologize people and engage them as fully human beings, we'll sort it out. Because that's what our society does all the time.
Right, right. And there's a little bit of a different judgment, though, if you're older. I had shared with you all a friend of ours was talking about some women she knew that lived in an independent living kind of apartment setting, and there were like 4 apartments, and the women decided they wanted to, take the risk and get together and make dinner together and not be with anybody else and self-isolate as a group. And so they were saying that the risk associated with that and getting food brought in so they could cook was worth it to them. And then there's the question of, well, is that putting other people at risk if they need medical care later? But that's the same for any of us, any of our neighbors who are choosing to do those things. But I think somehow with the risk factors with being older, well, and just in general, when people need support, we don't allow them to make, the right to folly that often. So it's challenging. There was another question that we had, not on the comment section, but that came up about somebody knowing someone who lives in a community and they aren't in an independent living apartment and not being allowed to order groceries in. And, there's other communities we know of people where people aren't allowed outside. And it's like, what are your thoughts on that? Like how, and Al, I think you had a question from someone who said, we're afraid to have kids send cards to our community because it could be bringing it in.
Experience when she suggested kids start a Penpal thing is that, oh no, we can't, the mail will be contaminated. First of all, the science doesn't show a high level of transmission through a letter that goes through the mail to begin with. But second of all, once again, to get back to Bill's point, everybody is a citizen. And if we follow those guidelines, we go to the grocery store, we shop, we use hand sanitizer, we wash our hands, we keep our social distance, and we come home and we actually, wash the produce and wipe off the boxes and things as we put groceries away. That can be done by anybody, no matter where they live. Open the mail, read your mail, don't touch your face, and then wash your hands when you're done. If you're that worried about it, that's what all of us do. I've got the mail truck coming by any time. I'm not going to say, sorry, I can't take mail because there's COVID out there. We have to work within reason. And once again, that's this idea of, is it possible to eliminate all risk? No, it's not impossible to eliminate. You negotiate risk, and you do it that are reasonable to engage with life, right, Bill?
Yeah, Al, thanks. I'm going to follow up with a term that you remember from the early years of Eden. We used to talk about the phantom rule book. So, of course, long-term care has lots of rules, man. Wow, lots. But in addition to all those rules were the rules that people just made up. So, for example, in this context, let's talk about the groceries. Well, let's go see what CDC guidelines have to say about that. Let's see what the World Health Organization has to say about that. Let's see what credible people who are making evidence-based recommendations have to say. And let's go with that. But to say kids can't write cards, that's phantom rule book stuff. That's not real. That's somebody being really nervous and saying no. So one of the things I'll say to everybody on the call, if you're in a community and there's a rule in effect, that rule needs to be walked back to where it came from and the authority or research or evidence that it's based on. In which case, good, you should follow it. If it's just somebody getting nervous, not good. That's phantom rulemaking.
Absolutely. And I was just reading an article this morning from a doctor in Canada who talked about what he called an infodemic. So there's an epidemic of misinformation basically going on out there. And unfortunately, it's being parroted by politicians, who are saying, do this, do that, don't do this. It's really important to find out what really needs to be done and what doesn't. And so once again, places like the WHO and the CDC are reliable websites. This guy did set up, I was just looking for the web addresses, something like COVID-19 misinfo.org or .com, something like that, where you can you can look for myths about that, because there's a lot of misinformation going on right now. You know, it happens. I mean, with the social media explosion that's happening every day, you know, whenever you see something posted on social media, you have to look at the organization that posted it and determine whether it's even worth opening and reading, let alone whether it's worth sharing or spreading to other people. So really, really important to put some critical thinking behind this. Do what's reasonable. I can't agree with you more. And I saw that Carmen Bowman was on the call, and I just have to repeat one of my favorite quotes from Carmen, who was a former surveyor, who now is a culture change specialist. And Carmen says, never take anyone's word for what the regulations or rules say. Read it yourself, because somebody may be misinterpreting it, and everybody's got an idea of what the regs say, but read it for yourself. Don't let the rumor mill influence our behavior.
Thank you. That's
Agreed.
great. And when you do, you know, I think organizations have gotten a little better with this, but when this first happened, and I think there are still some from what we're hearing where it's people have to stay in their rooms and not even go outside. And I look at you, Al, outside, and you can social distance and be outside. And I mean, my parents, my mom, I talked to her yesterday, and she said the only thing that's keeping her going is her walk every day and hearing the birds. She can't see, but she can smell things and hear things, and her exercise is so important to her well-being. And so, you know, if an organization does that, all of a sudden everybody's locked up. You do go back to, you know, the state of Colorado says we encourage you to go out for a walk. All of our citizens, we encourage you to go out for a walk. So I really like that, going back to the credible guidance and walking things back. That makes a lot of sense.
Yeah, we go for walks because we'd go stir crazy if we didn't. My daughter works in the emergency room at Rochester General, so she's keeping herself away from the rest of us. She goes from her apartment to work, basically. But she came over the other day with a lawn chair at happy hour time, and we shared wine. We were inside and she was outside. We had the window open, where we used the phone to talk, and she sat out in her lawn chair and had a glass of wine with us. My mother's in a retirement community a mile away. We walked up there yesterday and we talked her through the window, waved to her, she got to see her great grandson, and I was just waving to my neighbor across the street, who's a nurse who's been exposed, so she's keeping away. But you know, I can do it because that's not come from there to here and into my lungs. We have to follow science, and that's the problem, is that we've had this ingrained mistrust of science that is now really starting to bite us. That's as political as I'm going to get, but we have got to trust the doctors who have been doing this for a living for many years and know what they know and know what they don't know. And there are many things we don't know. As I was saying on a call with South Africa last week, a lot of the evidence we're generating now. We don't have, everything we're doing is not evidence-based, because we've never had a pandemic in our lifetimes. So some of the evidence is being generated, but some of it we know. We know what this virus is. We know what the structure looks like. We know how it's transmitted. We know what the symptoms and the incubation periods seem to be. We're really pretty good with that stuff. And so we gotta really pay attention to those things, I think.
Absolutely. Absolutely. And there was a comment here from Sina that I wish we could stop using the term social distancing and use the term physical distancing. And it's just what you just described, Al. With
nice, Tina.
Yeah, and I think we all agree with that. So I think if anybody had a question, we do have a comment. Thank you so much. I knew this would be uplifting. There has been so much don't and you can't, and I feel there are opportunities for growth and innovation. That's from Kathy Haynes Sealek. I think I'm saying that right. So thank you. That's a great. Kyrie's here. Hey, Kyrie. Everyone wearing masks and gloves can create a really frightening appearing world. And in the context of long-term care, how can we help make necessary precautions less fear-inducing?
We've already seen the incredible adaptive power of humans. The way the world looks right now, the way people walk past each other on a path, there are things that are just fundamentally changed, and we're like, yeah, okay, we get it. So it's really helpful to normalize some of the protective equipment. So I notice Al is wearing a coat. And Al, what's going on with the coat? I don't know. Well, he's protecting himself against the air that's still kind of cool, even though the sun's out. And I'm okay with it, Al. And look at the protective equipment on his face.
Yeah.
Yeah, what's going on with that, Al?
Right
Well,
in the afternoon sun, which I'm not used to seeing, so my eyes are blinded.
So if we people use protective equipment all the time. And if we just say, yeah, this is protective equipment that we use now because this is what's happening. So, but people use protective equipment every day. And we just explain it as a normal thing and it becomes normal, just like his sunglasses.
A couple other things that come to mind is that a lot of the people we're caring for are older people who have lived through other epidemics. Maybe not like this. Maybe they weren't old enough to live through the 1918 flu epidemic, but they've been through measles, they've been through polio, they've been through times. So talking about quarantines, talking about the history of that is a good conversation topic when you want to reminisce with people about things. Another thing that Karen Stobie mentioned on the webinar was that if you want someone to wear a mask, you can de-pathologize it, if I can use that word, by saying it's for your protection. Not you're dirty and you're going to infect others, but this will help keep you safe because we have some sick people here. There are a lot of ways we can present things that make them less onerous to people and treating them like lepers, you know.
That makes a lot of sense. So we are at 46 minutes and I want to do a little closeout, but I wanted to give you both an opportunity to say whatever you think is important right now, a message to the folks that are out there working communities or supporting elders at home. What message do you want to send? And I know I'm catching you off guard with this, but I know it won't be a problem for you too.
I jump in and just say, this is a hard time. Hard times pass. And the reason hard times pass is that we come together and believe in each other and believe in a better future. This will pass.
I agree. And I think that these are the kinds of challenges where community is the solution. And community doesn't have to be 10 people sitting in a room together. It can be the kind of community we're trying to create right now. But it's bringing the creativity of other people who are connected to you to help find solutions. And, you know, someone talked about looking back in hindsight. Yeah, we're going to make mistakes. Sorry, but we are. And that's not to be cavalier, but this is not perfect. This is complex. And we're doing the best we can. And all anybody can do is the best they can. And I believe that intention is what will ultimately carry us and past the hardest times. I'm with Bill. I see things getting better. They won't be the same. I think we'll come into a different world, maybe. That may not be a totally bad thing.
Yeah.
But I think that we will learn a lot. You can't help but learn, even from something as tragic as this, and find ways to live better. And maybe in some ways, you know, this is the wake-up call that society needs. Just like Bill has said for years, that aging is the wake-up call that society needs to help us understand that elders can teach us ways of being. Our vulnerable elders in times of pandemic can teach us a lot about ways of being too, I would say.
Thank you both so much. This was an amazing conversation, and I think that very simple, a couple of really simple messages from what you just said is this will pass. We will get through it. The power of community, and just we're doing the best we can. I mean, and I think we all need to hear that right now and remind ourselves of that. Because no matter what our role is in society right now, it's challenging for everyone. So I want to, go ahead, Al.
To express, and I know Bill, I'm echoing Bill too, our incredible appreciation for all the people who are out there providing direct support, whether professionally or personally, for people that need it. These are true heroes in our society, and we do salute you.
And that comes from the Eden Alternative as well. And that's why we're doing this. So we're going to be doing these Facebook live shows every Monday as a way to provide resources and opportunity to engage for people, and the people who really are the heroes that are out there doing this work. And next week, next Monday, which is April 13th, we are going to have some special guests to talk about ageism, because that's another thing that it's rearing its ugly head right now, right? There's a lot of things that are going on with, pitting generations against each other. And so how do we address that? So our guests next week will be Penny Cook from Pioneer Network, Kirsten Jacobs from Leading Age, Tracy Gendron, ageism researcher from Virginia Commonwealth University, and I'll be on that panel as well, and our own Laura Beck will be moderating that. So don't miss that. That'll be a really great conversation. And we would love to hear from all of you out there watching, or if you're watching this as a recording, put in the comment section, how can the Eden Alternative help you? What topics do you want to bring on the show? Who do you want us to bring on the show? If you want Al and Bill back, they'll commit to it, right?
Well,
I'm sure they'll come back.
As long as the sun's shining.
As long as the sun's shining.
it is
Well,
not indoors.
Well, again, thank you both so much. Thank you to everyone who joined us today and who's watching this as a recording. We really appreciate everyone's time. Bill, Al, thank you for sharing your wisdom with the